Deciding what type of surgery to have for breast cancer can be very daunting. This video will highlight some of the important factors to help you make the best decisions for you. My name is Alex Brown and I'm a breast surgeon in Wellington, New Zealand. Finding out you have a breast cancer can be very frightening. There's suddenly so much information to absorb, and it often feels like most of it is going over your head. Your breast surgeon will guide you through the options and help you make a decision how best to proceed. One of the important decisions is what type of surgery to have. There are two main possibilities: wide local excision, also called breast conservation surgery or lumpectomy, or mastectomy, with or without some form of breast reconstruction. Wide local excision removes the tumour with a margin of healthy tissue and preserves the rest of your breast. Mastectomy removes most of the breast tissue and without reconstruction leaves a flat chest with a neat scar. So, how do you decide what's best? Well, there's good evidence that survival is exactly the same whichever option you choose. But it's important to remember that the whole breast does need to be treated, so most people having breast conservation surgery will also need a course of radiation therapy. More on that later. Sometimes the distribution of cancer within the breast or the relative size of the tumour in the breast means that a mastectomy has to be performed. Most of the time, however, this is not needed. Wide local excision is usually performed as a day-stay operation, so you can go home the same day. The recovery is usually relatively quick and straightforward. You will probably need a week or so off work. Mastectomy, even without reconstruction, usually needs an overnight stay in hospital and a longer recovery. It's a bigger surgery, so you are usually more limited in your activity level for longer. Most patients have a plastic tube, a drain in the wound, that is removed after several days. You'll probably need a couple of weeks or so off work. If you decide to have a breast reconstruction, then surgery is more complex and recovery is longer again. Have a look at the breast reconstruction video for more information. Most breast cancer is completely treatable. The type of surgery you choose will not change your risk of dying of breast cancer, which is usually a lot lower than you think. It also won't change whether or not you're recommended a course of chemotherapy. If you choose a mastectomy, you are less likely to need a course of radiation therapy, but sometimes this is still recommended, particularly if there is more than 5 centimeters of cancer in the breast, or if there is cancer in the lymph glands in your armpit. However, if having radiation therapy might be a problem for you, you may wish to choose mastectomy. Earlier, I mentioned the margin of healthy tissue removed with the tumour during breast conservation surgery. Sometimes, when the tissue is analysed under the microscope, the pathologist finds cancer cells too close to the edge of the tissue. That can make us worry about cancer cells left inside the breast, so about 1 out of 5 patients need to have a second surgery to make sure all those cells are removed. If having a further surgery would be a problem for you, you might prefer to go straight to mastectomy. Anyone who's had breast cancer should have an annual mammogram for 10 years, unless you've had the whole breast removed. So, if having surveillance mammograms will be a problem for you, you also might prefer to have a mastectomy. There is a small risk of developing a breast cancer recurrence. That's one of the reasons for surveillance. The risk of recurrence is slightly higher after breast conservation surgery, but even after mastectomy, there is a small possibility of breast cancer recurrence in the skin around the breast area. Overall, most patients are treated with breast conservation surgery. Some emerging evidence suggests that survival might actually be slightly better after breast conservation surgery and radiation therapy compared to mastectomy. In general, if breast conservation is possible, it is usually the best option because it is less invasive, has a quicker recovery, and preserves your breast. If you would have difficulty with a second surgery, radiation therapy, or surveillance, then mastectomy might be a better option. I hope this video has been helpful for you. Have a look at my other videos to help you make the best decisions for you.